The first vaccine which we naturally give to the baby is breast milk colostrum. So the milk which is there for first 48 hours from the mother side is the first vaccine that a baby gets. It's rich in vitamin C, immunoglobulins, lactoferrins. So that becomes the first vaccine of the baby. The other vaccines that we administer to the baby are a BCG vaccine, which protects against tuberculosis given on the left shoulder, oral polio vaccine, and a hepatitis B vaccine on the thigh region. These are the three vaccines that are administered in the first 24 hours of birth. After that, at 1.5 months of age, 2.5 months of age, and 3.5 months of age, there are a group of vaccines that we give so that baby becomes immune to those common illnesses. The other group of vaccines are oral rotaviral vaccine, which protects the infants from rotavirus diarrhea, which is very common and a deadly disease of the infancy. So rotavirus vaccine is a oral vaccine which is given at 1.5 months, 2.5 months, and 3.5 months. The other important vaccine which is given on the by injectable route is pneumococcal vaccine. Pneumococcal vaccine given on the other thigh, and the rotavirus vaccine which is given orally. So these vaccines are given at 1.5 months, 2.5 months, 3.5 months. At 6 months of age, we tend to give a flu vaccine and a typhoid vaccine, very common diseases and very notorious diseases. So infants should be protected against them also. We give a flu shot again at 7 months. Typhoid is a single dose vaccine now. At 9 months of age, we tend to give measles, mumps, and rubella vaccine. And then there is also a meningococcal vaccine, MCV, which is kind of an optional vaccine because of the cost and because of the epidemiology of the disease. It happens in some states, it doesn't happen in others. So that is kind of an optional vaccine, but it could be also given at 9 months of age. Then at 1 year, after the first birthday of the baby, hepatitis A vaccine and Japanese encephalitis vaccine. So these are the common vaccines which are given in the first year of life. The most common and important side effects of these all vaccines is pain, fever, redness, induration, swelling, and less often an abscess. DPT vaccine, which causes most of the fever, pains. Usually other vaccines, they do not cause a long-term fever or pain. But yes, all vaccines, they do cause pain while the injection is being given. But yes, DPT vaccine is something which we need to look into. And we usually prescribe paracetamol syrup or drops once we administer this DPT vaccine, 1.5 months, 2.5 months, and 3.5 months. Vaccination is important. Please understand what is the concept behind vaccination. How does a vaccine work? We tend to inject diluted infection into the baby's body, and that causes an immune response to be generated inside the body. And whenever the next time that infection, if at all it happens inside the baby, the immune system is already ready to fight against that infection. So that is the concept behind vaccination. There are many myths which are associated with vaccination, that vaccination causes a lot of discomfort to the baby. Why at all vaccines are required? Let the baby's natural immunity work. Please don't think that way. We need to give passive vaccines to the baby so that that immune response of the baby is already there when these deadly infections like diphtheria, pertussis, tetanus, these are life-threatening diseases. So we cannot let newborns and infants let them fall prey to these infections and then generate an immune response. Rather than that, we should inject this small infection dose inside the body and let the immune system work against it. So more broader is the vaccination coverage, more is the baby stronger and healthy and won't fall prey to these deadly infections.